Hello, Dr. Laroche. How are you
Hello,
doing?
I'm doing well, thank you.
How are you keeping up within this COVID era?
Well, we're very fortunate. I'm in New York City right now, and our numbers are very low, less than 2%. And so it's safe to go around. We wear our masks with social distancing so we can get back to some sort of normalcy. So right now in New York, it's not that bad.
Fantastic. And you've made a statement, and I would like to get some clarification on that. You said that COVID-19 shines light on the disparities in healthcare among people of color. How is that so?
Yes, healthcare disparities have existed for hundreds of years in America. No one's really talked about it, okay? Or if you look at PubMed.gov, there are over 50,000 articles on healthcare disparities, but it hasn't really made the front pages of the media. Once in a while it does, but not on a regular basis. COVID-19, now that we talk about that every day in the media, and when you look at the death rates, where in Blacks and Afro-Latinos, the death rates are 2 to 4 times higher depending on where you are across the country. So now that's on the front page and people are talking about it and asking, well, why is that? You know, why is this happening in that respects? So this pandemic has really shined a light on these disparities that have existed for quite a long time, and we need to really fully address them.
And asking the question why, in your account, why does these disparities exist?
Okay, well, we have a system in America that was really built to create these disparities. I mean, if you go back to 1790, where the only people that could be citizens in the United States were white citizens, the Naturalization Act by law, and that, you know, Blacks were not allowed to be citizens, they were not allowed to own land, they were not allowed to, you know, have access to education. So when you go back, that was the foundation of this country. And so we've made a lot of progress where we all, including whites, have helped to dismantle slavery. We've all helped to dismantle segregation and Jim Crow in the 60s, but we've not really dealt with the institutional issues that were created under this system of white supremacy. Okay, and I'll give you an example. Like in my specialty as an ophthalmologist, okay, there are 40 million Blacks in the United States, but there are only 400 Black ophthalmologists in the United States, okay? Those numbers are really quite shocking, okay? And there are another 26,000 ophthalmologists from different ethnic groups, but there's a huge maldistribution on the East Coast and West Coast and a lack in the South. And because many of our communities are segregated, once again, because of the history, that leads to a decrease of access to cataract surgery, glaucoma surgery, diabetic retinopathy treatment, that leads to increased rates of blindness in the Black community. There's a shortage of doctors in many Black communities, so that hypertension is not picked up early, diabetes is not picked up early, obesity is not dealt with early on. And so you have all these underlying conditions that are much higher levels in the Black community compared to other communities. Also because of disparities of employment. Blacks tend to make up more of the essential workers, like the people that work in the supermarket, bus drivers, train conductors, and things of that nature. They're these, quote, essential workers, so they're more exposed to the virus. So that combination is a deadly combination, as you've seen across the country.
Great. And you just mentioned that the cases of COVID sort of are lower now in New York, but in the beginning, New York was one of the hardest hit. So what do you think they did right to sort of control the spread and now the numbers?
Well, one of the reasons New York was hardest hit is because we have JFK International Airport, which is like one of the largest international airports. And back in February, when the virus started out in China, but then there were a group of Chinese workers that had gone to Europe to work in Italy, and a lot of Italians were coming in through JFK. And unbeknownst to us, because the focus was on China and the West Coast, but the virus has already made its way into JFK, and it was just working its way around the airport. And all of those are essential workers that brought it home to their communities in Brooklyn and Queens that were the hardest hit. And so our numbers went up, unbeknownst to us, very, very, very high. Governor Cuomo, he did a great job with the shutdown and educating the people every day about wearing a mask, social distancing, staying home, and reinforcing that every day through his national teleconferences, and that educated the population, and everybody complied. And then our numbers came down dramatically, and we were reopened slowly. We followed the science, we followed the data, the science led by Dr. Fauci as well, and in the New York City Health Department team as well. So those things worked really well. I mean, and the basic things like wearing a mask, social distancing, washing your hands, trying to stay at home, improving in telehealth to communicate with patients and things of that nature made a huge difference. And it's really sad that, you know, we're seeing these high numbers in Texas and Florida and other places across the country that really didn't sort of follow that model that worked to keep the numbers down.
Good. And as a glaucoma specialist, how important is it to keep our eyes healthy during pandemics such as COVID?
It's very important. I mean, I'll give you an example. I had a very sad case recently of a 91-year-old woman with glaucoma who was scheduled to have cataract and glaucoma surgery in her second eye. She had very successful surgery in her first eye, but in her second eye she was scheduled, and it was just around the time, just before the shutdown. And she did not want to come out because of the shutdown. She was scared of the virus because of her age, understandably so. And despite all the medications that we tried to do, and then reinforcing it when we reopened for surgery during the pandemic, she still didn't want to come out. And then I recently saw her last week, which is a few months later. And by the time she came back to me, she completely lost her vision in that eye because the pressure was too high. Okay. So it's very important because during the pandemic and during periods of shutdown, people still need their care. They still need their care. They still need their surgeries. They still need their treatments for disease, whether it's heart disease, cancer, or whatever. And so it's very important to have a relationship with your doctor. Nowadays, we're using telemedicine with the phones. One of the things that we noticed during the pandemic is many of the seniors don't know how to use a smartphone. So it's very important to get the kids and the family involved during this time to get them a smartphone, to teach them how to use it, to teach them how to do a video conference with their doctor, because there are many ailments and things that you can do at home that the doctor can prescribe medication for you at home. If you're stable, he can tell you to stay at home. But if it's urgent, needs you to come in, he can say, hey, look, put a mask on, have your family drive to the house, from the house to the office. We will see you alone or with just one or two other people spaced apart, so everything will be very safe. You know, we have plexiglass, air filters in the office. All of our staff wears masks, hand washing very diligently, so we can reassure the patients so they can still come out and get the care that they need. Because unfortunately, there were a lot of people that did die, not from COVID, but just not being able to access the care that they needed in that respect, which is another unfortunate situation from the pandemic.
Great. So what are some of the underlying causes of glaucoma? And maybe we can narrow it down to even people of color, per se.
Okay, glaucoma is a leading cause of blindness in people of African descent. And there are multiple reasons for that. First, the main cause in my practice that I see, from what I see, the enlarging lens, the cataract, and you have a lens in the eye. As you get older, from the 20s to the 30s, 40s, and 50s, the lens gets larger. As it gets larger, it compresses the drainage angle in the eye. It starts to push the eye pressure up. Everybody has a normal eye pressure around 15. That's the mean normal is 15. The mean intraocular pressure in patients with glaucoma is about 18. And so in people over 50, it's very important to get an eye examination once a year. Get your vision checked in both eyes and know what the eye pressure is. If the eye pressure is 18 or higher, you should be concerned about the risk of developing glaucoma. And what we can do at this nowadays, we have new technology. We can do earlier cataract surgery and open up the drain with a trabecular bypass that will lower the pressure, bring it back down to 15, and help preserve your vision and can prevent blindness from glaucoma if caught early enough. The key is catching it early enough, because if you don't catch it early enough, if you don't go for your eye exam, if it's not detected early, you can go blind. And then once you go blind, we cannot bring the vision back. The key is preventing loss of vision.
Great. So, I mean, maybe we can end by you highlighting some of the ways you think this disparity in terms of the healthcare, as we started, could be sort of eliminated.
Okay, there are multiple things that can be done. One, we have to have universal health care insurance. We have too many people in this country that don't have health insurance, and thus they don't have access to care, and they can't get the preventative measures needed to keep them healthy. Because if we don't have universal health care, we're going to pay for sicker population to get care in the hospital. That's going to be sicker. So that's all. We have to make an investment. Many other countries do that, like Japan, England, Canada, and we have to do that. We also have to eliminate the structural racism that exists still, specifically in housing, employment, education, criminal justice, and healthcare. So we have to look at every area of society to help address that and look at the metrics and look at the numbers and really dig deep to dismantle the history that set these structures up and to break that down and to make it equitable for everyone with a focus on Blacks in particular. We have to address the inequity in wealth. Increased wealth gives you better health. The mean net worth of the white family is about 171,000. The mean net worth of the Black family is about 17,000. There's a huge amount of poverty, okay? And people are suffering. Right now, as I talk to you, people have food insecurity, housing insecurity, stress, unemployment, and all that affects your health. And so we have to address that. And one of the things that we need to do is maybe have a permanent guaranteed income. Martin Luther King talked about that. For people perhaps making less than $40,000 a year, maybe you get a $400 a week stipend to help them bridge the gap to take care of their families themselves. And that's an investment in America because all that money is going to be recirculated into the economy. And we have the money to do that. So that's something simple that will alleviate a lot of suffering and allow people to get out of poverty. We have to increase the number of Black physicians. We have to train more Black doctors to help meet the needs, the healthcare needs of the Black community and Black and Afro-Latino community. That has to be made a priority. There are infrastructural things within the educational system like standardized testing that keeps young Blacks out of school. I'll give you an example. In New York City, we have a magnet high school called Bronx Science, okay? In that high school, the percentage in terms of ethnicities is like 65% Asian and only 3% Black. That high school is the pipeline to train the future Black doctors, lawyers, and business people. Now, the population in New York is only 13% Asian and 26% Black. And that's all because of the standardized test, you know, because you have to take this certain test. There's so many biases financially, culturally with this test. Whereas if they change the, say, we're going to take the best students from each community. We're going to take the best students from the Bronx, Brooklyn, Queens, Staten Island, such and such. That would immediately diversify the school to reflect the population and solve that problem. So we have to make changes like that. But there are a lot of people that don't want to make those type of changes and want to keep the system the way it is. We have to pass anti-lynching legislation. Recently, several people were lynched in the South, still today in 2020, which is unbelievable. And so these are some of the things that we can do. And then also all government funding. When the government funds, like recently the government funded a vaccine company over $1.5 billion, okay? When the government's gonna give that type of funding to a company, that should be tied to diversity, diversity, education, and training. We say, okay, part of that money, you have to make sure your company is diverse, and you're gonna invest in diverse workforce with a focus on making sure you have adequate representation of Blacks and training in Blacks as well, so they can participate in that. Okay, that's not being done. If the government did that, that would go a long way to help make up for the historical inequities.
Right. And finally, although you are more of an eye specialist, we live in a time where Corona is the topic of the day, and there's been a lot of different sort of theories around it. But in your professional view, what advice do you have for people all over around the world when it comes to COVID? How serious is it? What should they do, right, to stay safe around this period? Okay,
COVID-19 is a very serious virus because it can attack any part of your body. It can attack your lungs. It can attack your ability of your blood, create clots. It can cause strokes. It can do a variety of different things. So the most important thing you can do is, one, make sure you wear a mask. If you go, particularly if you go out. If you can stay home, try to stay home. If you can't, if you can work from home, try to work from home. But if you have to go out, make sure you wear a mask, make sure you social distance, constantly wash your hands. Also, we're in the early stages of this pandemic. The people that do very poorly are people that are obese, okay? If you're obese, try to lose weight right now, okay? Because if you can lose 10, 20, 30, 40 pounds, that's gonna make you in a better position to fight this virus when it comes your way, because most likely it's gonna come your way at some point in time. And what you can do for that is drink vegetable juice, like put cucumber, celery, spinach, blueberries, put it in a blender, make a juice, use that, drink that 2-3 times a day, okay? 2 or 3 times a day. That will help you lose weight pretty quickly. It will give you all the nutrients you need, vitamin A, vitamin C, vitamin E, zinc, lutein, zeaxanthin, things that are good for your eyes and for your body. And that's gonna make your body stronger to fight this virus when it comes your way. And so those are the things I would recommend.
All right. Thank you very much, Dr. Laroche. We wish you all the best in the practice, and thank you very much for speaking with us.
Thank you. It's a pleasure. You have a good day.
Cheers. Have a good one.